And it's time now for our cover story tonight. As many as 10 million women and about 1 million men suffer from anorexia and bulimia. What, if anything, do these life and death disorders have to do with certain climates? Our Julie Martin examines the issue in our cover story tonight.
My eating disorder began late middle school, early high school, and quickly transformed into anorexia nervosa type 2, which is the binge purge type.
At the height of her disease, 20-year-old Anna Fox weighed just 90 pounds. Now in recovery, the third-year business student at Georgia Tech admits the onset of warm weather made her struggle all the more difficult.
It's a big issue. There's a big mental switch when the seasons change. Right around the time when Christmas was over and all of the spring wear was coming out and we started talking about spring break, just a lot more pressure to drop weight quickly.
In 2002, psychologists at Temple University set out to find whether those living in warm climates are at a heightened risk for developing eating disorders. After surveying college-aged women in both the southeastern and northeastern regions, they discovered the southeastern students had lower body weight, engaged more frequently in bulimic behaviors, and were more focused on body image than their northern counterparts. Atlanta psychologist Iréné Celcer has counseled patients with eating disorders for some 20 years. Based on clinical experience, she believes the Temple study holds some weight.
There are many factors that contribute to an eating disorder. Some are social, some are familiar, some are genetic, some are about peer group, and there's some that is definitely related to the weather as well.
Celcer doesn't believe the temperature itself breeds eating disorders, rather the societal pressure brought about by wearing less clothing in warm climates.
If we're talking about the social part and the emotional part, I think it's important to talk to our clients of what's coming, prepare them for what does exactly means for her or him.
For Anna Fox, that added awareness now means the warm weather is nothing much to worry about.
From the get-go, I look at myself in a different way than I used to, but when the seasons change, I also focus more on getting excited about activities with friends and not as much about what I look like, and not making my self-image and my personal appearance as important to myself.
Just like there's no one factor that creates an eating disorder, there's no one method of treating it. The most effective, a team approach involving psychotherapy, medication, and nutritional counseling. In Atlanta, Julie Martin, The Weather Channel.
And for more information, if you think you have a problem or know someone that does, log on to edap.org for information from the National Eating Disorder Association.